The scenes, behind the lines, inside the stories others won't tell. The Morning Insiders.
Most people dread going to the dentist, and now some hygienists do as well. One
told CBS 2 she's worried cleanings will help spread coronavirus as offices reopen. Morning Insider Lauren Victory asked the experts just how risky is a trip to the dentist.
I have trouble sleeping at night. I feel sick about it.
As expected, it is spreading across the state.
She's afraid for the safety of her patients.
It's just not safe, and it is going to spread like wildfire.
For her health.
We're not protected, and the patients aren't protected.
And for her job.
The office is open, you either go back or you're quitting.
That's why this dental hygienist asked to remain anonymous.
When you have a home and things like that, and children, it's you're put in a very hard position.
She says the high-tech cleansing equipment that sprays water into patients' mouths can create aerosols. And if a patient has COVID-19, these water droplets can cause the virus to spread.
Yes, we're at a higher risk.
Dr. Stacy Van Scoik is the vice president of the Illinois State Dental Society and a practicing dentist.
But we do everything we can do to decrease any risks that are presented into our offices.
She only lets her hygienists use manual tools like these because they don't create aerosols, but not every office is taking that precaution.
We've been told to do everything as we had done it before.
So there's several things you can do.
She says hygienists use the vacuum cleaner-like device to reduce aerosols. But
no, we cannot do 100%. So there is a risk. There is just the nature of our job.
Dental procedures are kind of risky endeavors.
UChicago's chief epidemiologist also says aerosols can increase the spread of COVID-19.
Treating people as though they may be contagious with COVID is probably the prudent thing to do. Time to put on an N95 mask and an eye protection.
And since there's not an endless supply of PPE, hygienists should wear a face shield over their mask and clean it after seeing each patient.
You know, we all do whatever we need to do to make sure that we're being safe.
Lauren Victory, CBS 2 News.
Now, it's also encouraged patients are screened for symptoms before they come into the dentist office. Wear a mask whenever possible and limit contact with staff by waiting in your car instead of the waiting room.